Good evening. My name is Chinesa. I'm a nurse practitioner from Brandman University, and my topic is Central Park Heights Community in Baltimore City. Community overview. Central Park Heights is a poor neighborhood with more than 96% African American. Overall population is 59,404, female greater than male in number. The leading cause of death in this community is HIV, homicide, and drug overdose. Unemployment in the Park Heights community is high. It is ranked the highest per capita crime areas of the city at one point. The style of building is mostly row houses. There are many abandoned houses because of dilapidation is run down. In 2018, the governor, Larry Hogan, pledged $52 million to revitalize the area within 10 years. The community has a high number of religious establishments, and you can see flyer and poster about churches on electric poles. Recreational centers are CC Jackson Recreational Community, where young people can read and play, and Jewish Community Center, a center for youth and families as well. This area you can pay tickets for some events, but at other times it is free. Income graph of this population, average household income roughly $54,000. And if you look at the graph, under 25 are making less than 25,000, 25 to 44 who already have families are making less than almost 35,000. And as you go along, you see that there is some poverty level there. Healthcare access. Osana Hospital is the major employer of the residents and serve as a primary care provider for the community as well as inpatient services. Other areas are Livingdale Hebrew Geriatric Center, but that is nursing home for elderly and disabled. And Park Heights Health Services, this is an addiction clinic to help people take their methadone and have individual and group therapy. Park Heights Community Health Alliance provides insight into how to navigate the healthcare system, healthy lifestyles, environmental justice, and community development. And Giant Medical Center is another kind of urgent care clinic also that provides primary care services for children and adults on a walking basis, and sometimes you have appointment as well. Facilitators and barriers to access to care. If you own a private health insurance, public, state, or federal sponsored health insurance, you have better access to care. Barriers to health care access are felt in this neighborhood due to poverty, financial burden, race, educational level, crime rate, disability status, and drug addictions, as well as other chronic illnesses. These have continued to negatively impact access to care in this population, leading to delays in preventable diseases, ER overcrowding, delays in receiving care that is appropriate, and preventable hospitalizations. Local public health services. The public health service is located further away from this community. Services provided by public health include men's health, sexually transmitted diseases, family planning and reproductive health, dental clinic, and oral health. However, some of the services are free for those who have tuberculosis or exposed, they receive free service for that. The men's health include provision of primary care services, screening, and health education. What services that I believe needs looking into is giving primary care services to uninsured females and not limited to just reproductive health. In addition to that, provide free vaccination to adults who meet certain criteria to ward off the rise of preventable diseases such as measles and pertussis. Vaccination rate. Immunization protects against preventable diseases. The school-age children, such as preteens and teens, are recommended to receive vaccines that prevent meningococcal disease, tetanus, diphtheria, pertussis, and HPV, human papillomavirus, and influenza. The graph on the next slide shows the mean Z-score of the percentage of adolescent ages 13 to 17 who received the recommended doses of Tdap, meningococcal, and HPV vaccines. Maryland, which comprises of Baltimore City and other counties, ranks number 14 on the scale. And these are the ranking, the state. Rhode Island is first in vaccination, and Maryland comes on the 14th. So we're doing good, but not where we need to be. Where can children be vaccinated if parents don't have health insurance? If a family has no health insurance, children can be vaccinated at the health department for free. The service is available to children and adolescents who qualify. Adults pay $25 donation fee for the flu shot at the health department. Private clinics, convenient urgent care clinics charge mostly $50 for flu vaccine. So that tells us where we can get flu shots and how much it costs as well. Disaster planning. Disaster planning is through the Baltimore City government in the form of provision of emergency medical services, law enforcement, fire and rescue services, reception, and mass care, donations, volunteers, shelters, and evacuation. Someone can learn more or become involved through the Community Emergency Response Team, a program by the City of Baltimore Mayor's Office for education about disaster preparedness for possible hazards that may occur in the community. Health promotion messages. This is self-explanatory. I love the way it pops up. This is about eating less, eat healthy diet, get started, how to get started, and how to be active. Another health promotion message is how we can be physical, and it tells you in the population, only 50% gets regular intensive exercise activity, 22% gets less, and 25% is sedentary, and 38% gets irregular activity. They do, but they are not regular. So this is why we have some of the diseases that we have today. Health promotion messages, this is about when to wash your hands, the appropriate time. This is very, very helpful. After you sneeze, before you eat, and things like that. Health promotion messages about vaccines. I think this is impactful because we really need vaccines to protect us from preventable diseases. We know measles came back, and pertussis actually came back, the whooping cough, because some people did not vaccinate their children, and those who were vaccinated had a decreased immunity because it's been so many years, so they were exposed. Community engagement. The City of Baltimore Government Office is trying to engage Central Park Heights community by disseminating information to them through a poster in their community recreational center about an upcoming job fair to give them equal opportunity for potential hiring in community jobs and general services. I believe that this type of engagement is effective as it catches people's attention, where it lays emphasis on what matters the most, and that is the opportunity to be gainfully employed to take care of themselves and their families. And here again is the community engagement poster. It is I like the color. It is sharp. It is eye-catching, and it's written in layman's terms: ready, set, hire. And this is going to take place April 14th, 9 a.m. to 4 p.m. And reflection, if you go through this overall rating levels, both schools, good families, jobs, you will see that we have jobs to do in this neighborhood. Housing is D because of the row housing and the way it looks, and so many abandoned homes. So we have work to do here. Reflections on what is needed. Much is needed with regards to safety, improved standard of living and drug addiction. There are improvements on the way as far as I could see because some of the areas are presently undergoing gentrification to conform to other more refined neighborhoods in order to attract businesses to boost employment rates with better salaries. This venture is likely to attract more affluent people to the neighborhood. There are many dilapidated homes that are abandoned by their owners, which are being teared down and rebuilt by the city of Baltimore government presently. Unfortunately, after the renovation, the poor population would not be able to afford the homes unless employment follows this improvement or the government subsidizes their rent. More effort is needed in the area of neighborhood empowerment and police presence to discourage loitering and selling of drugs on street corners. Here are my references. I thank you for listening. You have a good night.